You see the bulge?
Oh, he's swollen. The first thing that often comes to mind when you see a bird breathing heavily, mouth breathing, where the bird's beak is opening and closing with each breath, or bobbing its tail, where the tail is moving up and down with each breath, is a respiratory infection or air sac mites, especially with smaller birds like budgies, canaries, or finches. While these are possible causes, these symptoms can indicate many other health issues. In this video, I want to share my experience with one of my birds. I initially thought it was a respiratory infection, but it turned out to be something entirely different. My hope is that this story will help others learn to recognize and address similar situations. Recently, I noticed my 9-year-old canary, Sherbert, breathing heavier than usual. He also began mouth breathing and tail bobbing. I was concerned, so I made an appointment with my avian veterinarian. I assumed the vet would prescribe medication for a respiratory infection and Sherbert would recover with treatment. Unfortunately, the reality was very different. As soon as my avian vet examined Sherbert, he said, "I know what it is." I asked if it was a respiratory infection. He replied, "No, it's not a respiratory infection." He picked up Sherbert, held him close to my ear, and asked me if I can hear clicking sounds. I could, though it sounded like a heartbeat. The vet explained that it wasn't Sherbert's heartbeat. It was him struggling to breathe. The vet then examined Sherbert's abdomen.
See the bulge?
Oh, he's swollen? What is that?
That's fluid or tumor.
Oh.
Okay, and you can see his liver up here.
Oh, okay.
The dark area. I feel like there's fluid in there. I feel like I could draw off some fluid, okay? His breathing is he can't fill his air sacs.
Is that pushing up on him?
It's
to
pushing
make him
on
breathe
his air
that?
sacs. It's you know they have air sacs, right?
Yes.
Okay.
Yes.
They get squashed out of the way because I feel there's fluid in there.
Oh.
With your permission, I'm going to go put a little needle in here.
Okay.
And draw back and see if I can get some of this fluid out.
Oh.
It has risk to it.
Okay.
Okay.
He extracted 3 millimeters of fluid, which seemed like a significant amount to me. However, the vet explained that this was actually a small amount, indicating that most of Sherbert's abdominal swelling was most likely due to a tumor rather than fluid. Fluid buildup can be managed, but tumors are much harder to treat. Sherbert did not have a respiratory infection. He was diagnosed with a condition called ascites, where fluid builds up in the abdominal cavity, causing swelling. Ascites can result from various underlying health issues, including tumors, liver disease, heart problems, reproductive issues, or infections. Symptoms of ascites in birds can include tail bobbing, difficulty breathing, a swollen or distended abdomen, lethargy or weakness, reduced appetite, and weight loss. The prognosis for a bird with ascites depends on its underlying cause. If it's due to something treatable, like a mild infection or dietary imbalance, and it's caught early, a bird may live for months or even years with proper care. However, if the cause is more severe, such as a tumor, liver failure, or chronic heart disease, the prognosis is usually poor, with survival ranging from weeks to a few months, even with supportive care. In Sherbert's case, my vet recommended Lasix, a diuretic, to help reduce fluid buildup. While it might have provided temporary relief, the tumor was the primary issue. The vet also recommended euthanasia, as Sherbert's prognosis was very poor. He was blind, had feather cysts, couldn't fly, and now had a tumor and ascites causing him significant distress. I chose to euthanize Sherbert to end his suffering. It was an emotional day, but I said goodbye knowing he was now at peace. You know, you can't even breathe. You're gonna feel better soon, okay? Go say hi to all the other birdies that you spent your life with that are up at the Rainbow Bridge, okay? Maybe you'll find some lady canary up there, huh? Oh, it is hard. I love you, Sherbert. I love you. You're very good birdie and you're beautiful. If a bird shows signs of ascites, it's crucial to seek veterinary care immediately. Treatment often focuses on addressing the underlying cause and may involve draining the fluid, medications or dietary adjustments, or in some cases euthanasia to prevent further suffering. What I thought was a treatable respiratory infection turned out to be something far more serious. While I wasn't prepared for this outcome, I find comfort in knowing Sherbert is no longer in pain and has crossed the rainbow bridge. This experience taught me that respiratory symptoms can indicate a wide range of issues. It's always best to seek veterinary care promptly to ensure the right diagnosis and treatment. If you find this video educational and helpful, please give it a like and share to help awareness about bird health. Thank you for watching, and I'll see you in the next video.